Well, my name is Steve, and I'm a radiologic technologist here in the state of California. I have my license for the state and my ARRT, and recently earned a bachelor's degree in radiologic science. I've been in the field for about 9 years now, and I love every minute of it. For me, it was a career change, so this is basically my second career. And I was in computers before, so I really have a passion for electronics and technology, but I also like taking care of people, and I really enjoy that. And so what I did is I had the opportunity one day to go sit and watch CT, computer tomography, and I saw all the computers and the way it examined the patients on the table, and I was just blown away by that. And so I decided that's where I was going to go for my second career. Looked at a few programs and decided I wanted to go to Kenyatta, and Kenyatta is where I ended up, and graduated from there. They do offer certificate programs that I'm aware of, but I chose not to go that route. I don't think it's as widely accepted, and as probably most people know, you can't take your education away. Education is very important, so Kenyatta offers only an associate's program. So I did that, and I also knew I wanted to get a bachelor's, and without the associates, going for the bachelor's wasn't an option. So after I graduated, I applied for a bachelor's program, and they require that you work for a year in the field before you can even come into that program. And so that's what I did, and went on from there. To me, it's about how prepared you are to work. When you're done, you're ready to work. In my particular case, that was very important because I went to work on the night shift. I work 11 p to 11 a. I'm all by myself at night, and there isn't anybody there to ask any questions to, and it's a sink or swim. So when I graduated, I was ready to do that, and I've been doing that ever since. I don't know that you would call anything typical in medical imaging. You just never know what you're going to get. I work with people with different mental status, different physical abilities when they come see me. Generally, if you're getting x-rayed, you're hurt. So some people are okay to work with, happy and pleasant, which can be amazing when you see how broken up they are, and some people just aren't very happy at all. Some people don't even know that you're there. But regardless, it's my job to maintain their dignity and their privacy, and then at the same time I have to get the images that doctors need to make the decisions. And that challenge is what I like the best, because it's always challenging, and I like that. For every patient, I get a doctor's order. Absolutely nothing happens without a doctor's order, and then the doctor's orders have to be correct. And I have to verify that because they're not, the orders may come across to me, but they're not exactly what the doctor said, so we have to verify that. We also have to identify the patients with 3 identifiers always. And you do that by asking them. They'll have a name band. You make sure that all works out, and then it has to match the document in front of you. And then you're going to do whatever procedure. In my case, I do general radiography, and I do computer tomography, and I'll do whatever the procedure is. And of course, there's the textbook way that we learn in school, and then you have patients in front of you that don't always fit the textbook, so you have to figure out how you're going to get the views that the doctors want. To be able to help the patient. And then after you capture your images, nowadays everything goes into a PACS system, which is a computer archival system, and we don't have to carry those lead films around anymore full of silver that were very, very heavy. And so we don't have to do that anymore, and we just send everything off on the computer. And then when we go back, we always talk with the nurse, let the nurse know the status of the patient, make sure nothing changed. If something did, you explain it to them. And it also lets the nurses know that their patient's back. So you just don't want to drop them off and leave, So there's a lot of communication that has to happen in addition to just taking the pictures. What I like most is that it makes you feel good to know that doctors look through your eyes to see what's going on. And what I mean by that is a doctor just can't see what's going on underneath your skin. They use us to do that. And so we're going to show what the bones look like, or what your vascular system's looking like, or whatever study we're doing. And without those studies, the doctors will have no idea what's going on inside you. We're also their eyes when we do surgeries. We do a lot of surgery-assisted, right, and in the operating room. And they'll use our equipment to see where they're going, how to reset your bones. Sometimes we're always working with vascular surgeons, and they're injecting contrast, and they can actually see your blood flowing through your arteries or your veins, wherever they need to go. They do heart procedures, you name it. Without us, they don't really have the eyes, and I just love that, that we're right there in the thick of it all the time. What surprised me was my ability to just stay calm. It's amazing when you put on those scrubs and you put that hat on. It's a whole different environment for you. It's maybe in the street it would kind of make you very tense to see blood or whatever. But when you're in there, you're there to help someone. It can be very, very critical, and I was just able to stay calm with that. When you go in, you really don't know how you're going to handle those kind of situations until they're on top of you. And there's some things that happen that just touch you forever, and it's just part of it. But I think it surprised me the most that I was able to just handle that, handle people getting sick on you, the blood, bones sticking out of people's skin. It's reality for what we do, and it's amazing. On one hand, you'll think, oh, I could never deal with it, but when it's right in front of you, and it's your job, and you're there to help those people, you just do it. I think if you wanted to look at this career field, if you have a desire for the technology and the new things and constant change, this is the right thing for you. The other thing that I would point out is that this requires a lot of patience. Patience in yourself to deal with people that are probably going to try you. They get a little angry, sometimes they're yelling, you're trying to get something done, and sometimes you're hurting them a bit. But you have to have the patience to work through and get through what you need to get through. And you need critical thinking skills. If you don't have the critical thinking skills, it could be very difficult. Because, like I said, it doesn't always fit the textbook, this job. And you have to be able to think through things, think through your situation, reevaluate sometimes, and do the best you can. At the same time, you have to balance what's going on with your patient.